Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Just a note at the top that this episode does mention abuse and trauma of children, so please take care when listening. Today, Johns Hopkins professor Elizabeth Letourneau is the director of the Moore Center for the Prevention of Child Sexual Abuse. She joins Dr. Josh Sharfstein to discuss her new book that details this terrible public health problem and offers new perspectives not only on how to address it, but how to prevent it. Let's listen.
Professor Elizabeth Letourneau, thank you so much for joining me today on Public Health on Call to talk about a difficult topic. It's a topic that you have worked on for many years. It's a topic that we don't talk about a lot, child sexual abuse. You've just written a book with Luke Malone called 1 in 5, Why Child Sexual Abuse is Our Biggest Public Health Crisis and What We Can Do to Stop It. I appreciate your joining.
It's a real pleasure to be back.
So I want to jump in with some basic definitions. When you use the term child sexual abuse, what are you talking about here?
We're talking about harmful sexual behaviors committed by somebody specifically for the goal of achieving some sort of sexual pleasure against a child. And when I say child, I mean anyone under the age of 18 in alignment with the UN Convention on the Rights of the Child. And certainly sexual harm can be caused by anyone of any age, but I'm not talking about consensual or mutually desired close in age sexual behaviors between peers, even if those are technically illegal. So we are talking about behaviors to which a child cannot consent because of age or incapacity or does not consent.
How common is child sexual abuse?
Well, you mentioned the title of our book, which is 1 in 5, and those are the latest prevalence statistics for victimization in the United States. Those include hands-on and technology-facilitated abuse and exploitations.
That's a very high number.
It is.
That's millions of people.
It is, and millions who have it coming before the age of 18 and millions who are living with the consequences of it.
That's why you call it our biggest public health crisis, based in part on the sheer number of people. Talk about the impact a little bit more.
Sure. The impacts are very well established, and they can hit really any aspect of a person's life. So somebody who survives child sexual abuse, there's immediate harms of the events themselves, but there's also increased risk for severe mental health disorders, including PTSD and depression and anxiety-related disorders. Behavioral health is associated with victimization, so increased risk for substance use, problematic alcohol and nicotine use, disordered eating. And then there's also links with physical health. So child sexual abuse victimization is associated with cardiovascular disease, longer in life, hypertension, cervical cancer among women. So these are, very long-term, very severe outcomes. And then also it has impacts on people's lifetime earnings, which some of our research has shown, and academic achievement. So there's just reproductive health, relationships. It goes on and on. It really touches or can touch every aspect of a person's life.
Right. One of the very interesting things about the book is the history lesson that's here about how society has addressed this or tried to wrap its mind around this challenge, including its scale. And one of the things that jumped out at me is that there have been moments in time when people have said, this could be very common, but they've sort of backed away. And one of those people is actually Sigmund Freud.
Yeah, he really did a disservice to children. He recognized in many of his clinical patients that they had been abused. They disclosed having suffered often at the hands of a family member. And he initially approached this as something that needed to be addressed. And he gave a presentation to his peers and was sort of roundly ridiculed and disbelieved. Rather, people were much more comfortable thinking that kids were making these allegations up or inventing these kind of memories. And we see that again and again and again in history where people push back against the idea that children are honest when they talk about child sexual abuse events, or that survivors are accurately recalling what happened to them. And I would say even today, it's much easier for people to think of stranger danger specifically when it comes, or particularly when it comes to child sexual abuse. It is just easier for folks to wrap their heads around the idea that a stranger might do this, but not somebody that we know or even care about in our own social circles. And I think today we see this manifesting there's much, much more interest in and discussion of online harms against children. Online harms, like in-person harms, are still mostly perpetrated by people known to the child or to the child's family. There's more stranger danger online. But I see this tendency to back away again from the clear understanding that this type of harm is caused by people known to the children, and it is quite common.
And as some of the stories in the book make clear, that within families, it may not be just one person who is being victimized, that it can actually be quite a number.
Yes, absolutely. We see a lot of intergenerational transmission of abuse, or I think more clearly we see someone who has started offending, unless they're held accountable, continuing to offend, including with their own children and with their own grandchildren and the children around them, maybe friends and other family members. Yes, that is absolutely something that happens.
So in the book, you describe the problem, you talk about its scale, talk about the history and how it's been hard to really recognize. And then you get to interventions and what we can do to stop it, part of your title. And we're not going to talk about this very much in the podcast, but you point out that the kinds of interventions that are most salient now may not be particularly effective, particularly at prevention.
Yeah, the policies are typically reactive policies. So we have criminal justice, law enforcement efforts, which we absolutely need. Like, this needs to be robustly dealt with criminal justice sanctions against adults who offend against children, for sure. And then there's civil sanctions that can follow prison, for example, sex offender registration and notification. And the problem with those kinds of responses are, one, as I mentioned, they're reactive. So a child has already been harmed. So that's too late for that kid. It's also too late for the person who caused harm, who might have been prevented from going down that road. But the other issue is that 95% of all sex crimes, maybe more, are committed by somebody with no prior sex crime conviction. So even if those strategies did work, they would only be dealing with 5% or less of the problem. We have to do more to prevent harm from occurring in the first place that moves beyond reactive criminal justice strategies if we're really going to be able to address this at scale.
And so prevention of child sexual abuse is a big focus of the book, but it's a kind of novel concept, I think, for a lot of people. How would you introduce someone to the idea that these horrific circumstances can be prevented?
It is novel, and even for people working in prevention, many have told me that it's very difficult for them to envision what prevention looks like. So I have two strategies. One is to link back to other prevention efforts, so use of the infant car seat, gloves that healthcare providers wear. And there was a lot of pushback to those as well, that people just didn't want any barrier between them and their patients. Doctors and nurses push back against having to wear gloves. Parents of all stripes push back against having to use baby car seats because they're a pain, frankly. And what's lost, those things now are just they're part of the fabric of daily living. Nobody gives it a second thought. But what folks don't remember is there was real pushback when those were developed. And so it's no surprise that there's pushback against this idea that we can prevent child sexual abuse. This is something that I think every public health issue goes through. And it's really a matter of meeting people where they're at and framing how we talk about this issue in a way that really overcomes these inherent biases. So one inherent bias is that people who might commit a sex offense are going to, that they're monsters. There's no way to dissuade them from what could happen. And getting people to recognize that most people who commit sex crimes don't look like the guys in the newspaper. They don't look like Jeffrey Epstein, who's importing victims from other countries, or like Larry Nassar, who has 300, 400, who knows how many victims. It's much more common for somebody to, again, be known well to the person that they abuse, to have not hundreds of victims as a rule. And many, many times, and in the United States, most often, it's somebody who's under the age of 18. It's another child. And when you recognize the picture that these are other children, usually a couple years older, they may be a stepfather who's mostly attracted to adults, but has allowed himself to go down a very bad road with his stepdaughter or stepson. you begin to be able to see these more as cases that could be prevented.
When people think about preventing childhood sexual abuse, they often think about teaching kids to avoid strangers. What is your view on that kind of training?
Yeah, my view is that that doesn't work. Most harm is not caused by strangers. Most people who sexually abuse children know the child well or know the family well. And that kind of training is just really, really off the mark. Also, kids just don't have the agency. We teach kids to obey adults, and they need to in most cases. They don't have the agency to distinguish when there's an adult asking for something that's inappropriate versus an adult who needs them to do something to keep them safe. So I think that kind of strategy is pretty far off the mark based on everything that we know right now.
What would be on your list of things to do?
Well, the first thing on my list is to recognize that kids are at risk of victimization, but they're also at risk of causing harm. And this isn't because they're miniature predators. It's because as children enter puberty, they're starting to grapple with the most complex things they're ever going to do. So sex and relationships and love. And we don't really give them much in the way of guidance around those. And in fact, sometimes we hide the guidance around that in this misbegotten idea that if they don't know anything, they won't experience any harm. And of course, they will, and they may actually cause harm even without meaning to. So I think what we could do that would be a lot more effective, and what we're seeing is a lot more effective through some really great emerging science, is working with kids and teachers and parents to recognize that we need kids to have an understanding of their own rights and responsibilities when it comes to sexual behavior and everything that goes with that. And recognize that they also need to know how not to engage in harmful behaviors. So what is consent? How do you get it? Also, how do you give it? How long does it last? Who's an appropriate partner? That's something that a lot of people don't think about talking to their kids about. They may talk about consent with peers. They may talk about how older people should not be touching their body parts. But most of us as parents don't also then say, and also, by the way, you shouldn't touch a younger child's private parts, and here's why. And kids need that information. They don't know it. They don't know that that's against the rules until we tell them. We have a school-based prevention program that does exactly that. Teaches about concepts like consent, concepts like who's an appropriate partner, not somebody older than you, not somebody younger than you, but close in age peers, and how to identify a safe adult, how to behave appropriately online when you can feel very anonymous and can cause harm without even intending to. So that's one thing I would say about really maturing our school-based prevention efforts.
Got it.
Yeah.
But what about for adults who do know better? Can that be prevented?
Yeah, absolutely. That can be prevented. It's a difficult concept to believe because no one can really appreciate or understand why somebody would do this. And I would not ask someone to try to appreciate or understand why somebody would sexually abuse a child. At the same time, we absolutely know that these behaviors can be prevented, just like child physical abuse, child neglect can be prevented. We can prevent these with targeted strategies for at-risk populations. So one at-risk population that will come as no surprise to your listeners is people with sexual attraction to children. What might come as a surprise to your listeners is that many of them seek help. They don't want to hurt a child. They don't want this attraction. There's really nothing they can do about it. It seems very stable across the life course. But they want help to not offend and also to live a healthy, meaningful life themselves. And so there are now numerous interventions, many with good evidence base behind them, that reduce the likelihood that they will act out on those attractions and increase their control and their health and well-being, which also helps them keep control over their behaviors. That can be prevented. Another risk factor is someone who is using online legal pornography, but a lot, is maybe out of control with that, or uses sex to self-soothe or to get through the day or whatever. And those folks are at risk to start to begin to look for child sexual abuse materials as they get bored with legal materials. And intervening quickly with them, often through just a quick warning that pops up when they put in search terms online that indicate that they're searching for child sexual abuse materials, a warning that reminds them this is harmful, it's illegal, but that also links to a help site. We have evidence now that those kinds of strategies also work, and those are really simple and low cost to implement.
Right. And it goes without saying, if those strategies are helping some of the people, they are actually preventing a lot of victimization.
Yes, and that's exactly what we want. We want a child to get through childhood without experiencing child sexual abuse. It has enormous downstream positive impacts for a kid to get through childhood without experiencing that really particularly egregious type of harm.
Now, in the book, you call for an Office of Child Sexual Abuse Prevention in the federal government. There are all kinds of other policy recommendations. I just wanted to ask you about that one. What would that office accomplish?
What it would accomplish, or in an ideal world, what it would accomplish is to help engineer a national, comprehensive, cohesive strategy for preventing child sexual abuse. We don't have that right now, but we did have it at one point in the late 1970s and early 80s, and it got abolished. And even as briefly as it was around, it really had an outsized impact on innovative solutions to preventing and addressing child sexual abuse. And we absolutely need to build that out. There just is not enough sustained attention that comprehensively addresses child sexual abuse. You have efforts that address online offending, efforts that address school-based issues, and that's pretty much it, actually. And we've seen this work, and we're seeing it work, especially in Australia. They've really pioneered how to do this right. But we're also seeing the EU and the UK and other countries really come up to speed on child sexual abuse. And I think we could be a real leader there as well. But it is going to take sustained effort and somebody having responsibility for it. And that means you simply have got to have an office.
It seems like to make progress, this is a topic that we really do have to confront. And your book is really important in getting people to see the facts, see what's possible, and open the discussion about a stronger response. Thank you so much for joining me, Elizabeth.
Thank you, Josh. Again, it was a real pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.